Okay, I'm here in Jose Guerra from Barcelona with Martin Cowie from London. After this exciting session on artificial intelligence, we are here with one of the panelists, that is Jagmeet Singh from United States. Sorry.
That's right. That's right.
And actually, what's your opinion how artificial intelligence is being implemented in EP, Jack?
Oh, that's a loaded question. I think artificial intelligence, if you want to look at it, can be categorized as something called narrow artificial intelligence and general artificial intelligence. Narrow artificial intelligence already exists, so that's more specific, task-based AI. It exists in device therapy, ICD therapies. It exists in remote monitoring strategies. It also exists in risk stratification approaches right now. So there are forms that it already exists in, but I think the more interesting form is in the general AI side of things, is how do we take it beyond that into electrophysiological procedures and devices as a whole, and how can that integrate with electronic health records? So there's a lot that AI can move towards.
How do you think our life are gonna change in the near future, in the long perspective? How do you think that we are doing a completely different electrophysiology that we were doing 10 years ago, but how it's gonna be in 10 years' time?
So I think as an electrophysiologist, our practice is going to evolve to have AI become a part of it. But before it actually becomes a part of it, we need to be able to get a lot of the large data into our electronic health records and then help establish precision medicine platforms that can then be analyzed by artificial intelligence, either in the form of machine learning or cognitive computing or deep learning, that will then allow us to precisely deliver precision medicine. Now that's going to change for different things in different ways. For example, on the device side of things, there is the potential for devices to become more autonomous in the way they deliver care in the future. And that autonomy will be driven by how, I would say, effective the AI is within the device. And there are different levels of autonomy. It can give us autonomy at the level of the provider, at the level of the patient, or the device by itself. So it is going to change how we even get, remote monitoring signals from devices, for example. That information which we get from devices will be integrated by language processing strategies from electronic health records that will help subcategorize the remote monitoring alerts into high alerts or moderate alerts or critical alerts. So that'll filter them down, so it makes life a little more easier in terms of how we deal with the remote monitoring alerts. So I think that's going to change how our practice evolves. And then on the interventional side, I think how these AI interfaces with our delivery of interventional care is going to evolve also. I think we'll be able to predict using artificial intelligence strategies as to what is the right spot to ablate to actually terminate atrial fibrillation in the future. We will be able to also use algorithms to help us understand what's the best pacing strategy for certain patients with certain disorders. So there's a lot going on out there, but a lot of what will be delivered is going to be directly dependent on training data sets, collaboration between different institutions, and then integrating that information into our EHRs to help us analyze that data.
Completely right, and we have been discussing about this sharing information, this data set that we have to share, and we have to, and we should participate in this kind of collaboration. How you think should be the sharing process? How we should, as physicians, participate in the sharing process with institutions, with engineers, with mathematicians? How should be the process, and how would our institution should participate in this process?
I think it's challenging to really determine how they interact. I think first is to really establish the need that artificial intelligence strategies cannot be developed without multifunctional or multidisciplinary groups. And that's first, the recognizing that. And then is really bringing the institutions together and saying, if we need to look at ablative strategies to terminate atrial fibrillation, we need a data set of a few thousand patients. We can't do it at a single center by ourselves. How can we get this data from different centers and work together to develop that AI algorithm to help us make our ablation strategies more successful? So it's going to be physician talking to physicians, institutions talking to institutions, and then obviously bringing in all the computer scientists and other allied specialties that could be interfacing with that particular technology or that particular issue at hand.
Definitely have.
Across Europe, that's quite a challenge because, as you know, each country has its own attitudes towards data sharing, and actually healthcare professionals work in very siloed data, which is heavily protected. So the whole idea of AI and IBM Watson is you can search very widely in a huge number of data sets. So I think there's some forces at work that need to be thought through, and we need to have a legislative and regulatory pathways that assist what we can get from artificial intelligence, and differences across the Atlantic in terms of attitudes to data security, etc. So AI, I think, is an enormous source for good, but we've got to think about all that has to go around it to facilitate it being used properly and to maximum value.
Absolutely, I couldn't agree with you more. I think there are so many nuances to it. Demonstrating the political will is something, and then working with all the nuances that you talked about. And data sharing by itself brings a lot of ethical issues, as you just alluded to, and then the patent-related issues that will come up with it, because as these deep learning algorithms are put into place, they're not static, they're evolving. And what are the patent laws going to be as these algorithms evolve? So it's there's a lot of exciting stuff to encounter.
Definitely, it's a terrific topic, and we have enjoyed a lot this session. And I would like to thank you, for being with us, and I hope to see you in 20 years' time practicing a completely different medicine and with a big cooperation between Europe and the United States of America.
Thank you, and hopefully I'll be artificially intelligent at that time. Thank you.